Greetings and welcome to Healthcare Leadership Live. Welcome to everybody listening to us live and on the recorded podcast. I'm so excited that y'all are joining us here today. And as always, Healthcare Leadership Live is here for the practice leaders out there running healthcare clinics who want to level up their business, level up their leadership, and learn more about this awesome business of healthcare and how we can all do it better together. And today's guest brings a few different perspectives that I'm super excited to dig into. He's got a number of hats that I think will be really insightful for folks in healthcare. My guest today is Neer Patel. Thanks for joining us.
Thanks so much for having me, Mike.
Yeah, absolutely. And Neer works with a DPC practice here in the Austin area, and he also has a benefits business that helps businesses, healthcare businesses, all kinds of businesses get access to healthcare for their staff, which is a different model and a new model, and I think one that I definitely want to dig into. Um, so yeah, Neer, I guess let's start out by what is it that you do, and why do you do it?
Yeah, so I run a couple companies. One's called Direct Med DPC, a direct primary care practice here in Central Texas, and then another one is called Virtuous Benefits, a full service nationwide employee benefits agency. And the why I think is twofold. One, to support my wonderful family. I have a wife and two kids, two boys, 8 and 10, and they're why my wife and I do everything that we do, is to support our kids and show them hard work and entrepreneurship. Um, and also, I think we got into this 11 years ago because we felt like the healthcare system was extremely broken. Um, my wife's a family physician. I come from a family of 40 physicians. So I've grown up around medicine my entire life. I've seen the brokenness. I've seen independent practices getting swallowed up by big systems for many decades. And my wife and I just both have had such a passion for trying to fix it. And so that's the other why as to why we have our businesses.
Well, those are some huge whys right there. And I know that this trend of frustration with the traditional insurance payer model has been, I guess, accelerating. And I feel like this year it's just been more of the same with increases greater than normal. And I don't know, have you seen increasing? You talk a little bit about this on the physician side, but have you seen an increasing frustration on all parties with the current traditional model?
Absolutely. Yeah. Just in the full 11 years that I've been doing this, I mean, nothing, I haven't seen anything really change. It's always, the healthcare dance that everybody's doing at the end of the year or closer to their renewal where they're anxious and worried about, what kind of increase are we going to get? And then it's like scrambling to figure out, well, what do we do? And so we're really excited to be part of the solution of that rather than on the
Mm.
other end.
Yeah. And both of your businesses are really kind of involved with that issue. So I kind of want to dig into both of those things, and maybe starting out with the direct primary care practice side. Um, you were the person that first introduced me to this idea a couple of years ago, and I've been learning more about it. But for those who aren't super familiar with direct primary care, can you just kind of explain what it is and why is it that providers and consumers of healthcare seem to be gravitating towards it?
Sure. Yeah. So I think a couple of the easiest ways to explain kind of what it is most people enjoy sports and have a favorite sports team. And so we use the analogy, it's very similar to the team doctor that's on the team that works for the team, of your favorite sports team, right? Because that doctor works for the team. They know the athletes really well. When somebody gets injured on the field, the doctor is running out on the field and addressing whatever's going on. Nobody's trying to figure out, are they contracted with Blue Cross or United Healthcare, and where can we take them, right? There's a doctor that knows that patient and runs out on the field and helps him out. And that's really what direct primary care is. And the second part is it's a relationship. And that's what, I think has become lost in this country with just no more continuity of care. You don't get to see the same doctor who knows you really well and knows everything about you and your family, to where they can actually help you get healthier. You have to, you get shuffled around between many different medical staff, and you have to tell your story 15 different times every time you go somewhere for healthcare. And so this idea of a relationship, it's so important in primary care. It helps a doctor be able to do their job so much better than, than without having that and just having thousands and thousands of patients that they have to take care of and can't keep track of. So I think those are the two things that, that really allow direct primary care to provide such a different model when it comes to primary care.
Yeah, I would love to have, a doctor run right over, when I am not feeling well. And from what I understand, providers often in DPC practices, you can even text them or email them anytime. Has that been your experience?
Absolutely, yeah. You can think about it like affordable concierge medicine,
Mhm.
right? So your doctor in this model has a very small number of patients, a fraction compared to the insurance primary care doctors, and that allows them to not have to rush through visits, right? They're seeing, 4 to 8 patients a day versus, 20 to 35.
Yeah.
And so there's a big difference there. They're capping at 4 to 600 patients on their panel versus 4 to 6,000.
Mm.
And so, yeah, it just, they DPC doctors allot an hour at every visit. They give you their cell phone number. So it's really great access, and it's really high quality care because family doctors go to school for a long time, and they're trained really broadly. They can handle about 90% of our care. And people are shocked when I say that because they're like, my doctor, I can, it takes me 3 months to get in, and then, I wait for 2 hours, and then I see him for 5 minutes, and they give me a medicine or, send me to a specialist. So I don't know how they can handle 90%. But yeah, with time, you'd be surprised what they can do.
Mm. Yeah, and I don't know what the stats are on this, but I suspect that with more robust primary care, you probably get better health outcomes in the long run for patients. I don't know if do you have any stats or knowledge bombs on that topic, or is my intuition going to just remain intuition on that?
No, you're absolutely right about that. I mean, with good primary care, a doctor that's trained to handle 80 to 90% of your care gives you good access, helps you understand what healthy is, right? They're able to help you kind of make small changes over time so that you're not creeping towards chronic disease. They can, help avoid ER visits, urgent
Mhm.
care visits, right? It's like having a doctor in the family. So when something's going on at night or on a weekend, your DPC doctor is going to be able to be there for you and triage what's going on. They won't see you in person after hours, but they will help triage what's going on through texting, video call, phone, and help you avoid an ER visit a lot of times, and just avoid expensive medications and all the other expensive care.
Mm.
Um, the traditional health system thrives the sicker that we are. So this idea of proactive wellness and health is not embraced by the traditional healthcare system we
Mm.
have in the country. And so DPC doctors have decided to take that into their own hands.
Yeah. And from what I've heard from some DPC providers is there may even be access to pharmaceuticals at discounts potentially, or testing at discounts. Does that usually come with DPC?
Absolutely. The DPC doctors all over the country get the lowest price for labs that anybody in the country can get,
Mm.
and they pass those prices along to their patients. Same thing with medicine. They can buy the generic medicines at pennies on the dollar and hand
Mhm.
them right to their patient in their office.
Wow. Yeah, sign me up right now. Like, where do I I mean, this is a real thing right now because people are seeing their costs go up so much, and they're not seeing their care, go up. Another thing that where I think here on the just thinking about the provider side is I would think that clinicians are frustrated with the corporatization of medicine and being an employee, and that this opens up a different business model, maybe more or less, I don't know, profitable, but possibly better, from a mission perspective. I don't know. What are you seeing on that side of things?
Yeah, and like I had mentioned, I've grown up around medicine my whole life with my family, and so this is really just the return of independent family medicine, primary care, family practice again, right? There used to be independent family practices all over the country 50 years ago.
Mm,
Um, and this is just a return of that in a different form, right? And so now when they come and hang their own shingle again, they do it under a very affordable membership model. It's just like a gym membership.
mhm,
And so you charge your patients a very affordable monthly fee, generally $100 a month for adults, half that for kids, and you can use your training to handle 90% of their care and give them good access. You're going to start making your patients healthier. You're going to keep them out of more expensive things and keep them healthier, help them live longer. And so that's really, it's a win-win for the physician. It's a win-win for the patient. And you're right, they are absolutely sick and tired of being pawns in the corporate system. This whole started with my wife when she came home crying one day from her urgent care job, saying, I had to have one hand on the door trying to get out of the room when somebody's crying, telling me about some
mm,
traumatic event that occurred, because I had 15 other people in 15 other rooms to see. And then I also had to do all kinds of charting in order to get reimbursements for all those patients that I saw that day. And it's never ending, and I can't deliver good care to anybody. And so I'd rather quit medicine than continue
mm.
in this.
Yeah, and I feel like I've heard that story, on social media from other physicians, as well. I'm curious. I do a lot of work in the eye care space, ophthalmology. Have you seen providers and clinics in non other specialties or other, verticals of healthcare other than primary care, kind of adopting that sort of same mentality? Does it not really lend itself towards specialty care?
No, I would say it absolutely does lend itself to specialty care. So as this DPC, direct primary care movement, has been growing exponentially for the last, I would say, 15 years, DSC,
Mm,
direct specialty care, now has also been growing, I would say in the last 5 years pretty significantly. So there's a direct specialty care alliance. You can go Google them, find their website. They've got a map, and you can find specialists in your area that are doing direct care where
mm.
they're not billing insurances. They're charging affordable and transparent prices for the services they provide, and they're just delivering phenomenal care to their patients.
Well, that's cool. I'll have to check into that. I wasn't aware of that. This is probably a good time to say for anyone listening live to the show, if you have a question for Neer or a comment, or if you're a fan of DPC, just drop a comment into the chat and we will share that here live. And we'll answer your questions. Neer, I'm sure, would love to answer any questions that you have about direct primary care. Um, and this may be a good time to transition, to kind of the different side of this, which is, if someone has a business, let's say they're a healthcare leader and they have employees, one of the things that is on everyone's mind right now, if you offer benefits, is how can I continue to offer affordable benefits for my employees, ones that they'll use, ones that will really help them become well or maintain their wellness. um, and where does DPC fit into that question?
Yes, that's a great question and a great topic. Uh, a topic that's very relevant right now with everybody getting all these businesses around the country getting their health insurance renewals from their network-based carriers. Um, so yeah, there are lots of different ways to do health insurance when you're talking about employee health care, as you know. Um, there's fully insured plans where you just pay a fixed amount and don't ask any other questions. There's level and self-funded plans where you get to build your own health plan and you get to see the transparency behind, what's happening with the money we're paying in and where's it going and what's happening with it. And so um, we're a part of that latter model where we help companies around the country self-fund um, their plans.
Mm. And so how, if a business wanted to incorporate DPC into their offerings for employees, what does that look like exactly?
Yeah, so the plans that we build are completely direct care centric. Everything revolves around direct care. So we don't use networks in our health plans. So like a Blue Cross network, a United Healthcare network, right? We remove those networks from our health plans and those contracts that come with them, because believe it or not, those contracts that they have with doctors and hospitals around the country aren't in consumers' favor.
Mm,
So when you remove those contracts, you've removed a lot of the greed that exists in a health insurance plan, and you can make it pure and genuine. And you can also incorporate things like DPC. So in our health plans, we always build DPC into them. And the idea behind that is, if you've got a doctor that left the traditional system and their high paying salary, right, because they care more about their patients than profits, to a company, that should be the type of doctor that you want taking care of your employees, somebody
mm,
who's super genuine. And when they open their practice in this model where it's an affordable gym membership style model, and the costs are very reasonable, and you're just paying one fixed amount for almost 90% of everyone's care, you're basically steering most, if not all, of the claims away from an insurance plan. And
mm,
insurance is all about risk. The more an insurance company pays on the behalf of your employees, the more they charge you. It's very simple.
mhm,
So if we can get the insurance to pay out less, then we can keep costs very well under control.
mm. Okay, so DPC can be a cost control strategy for the long term, is what
In
you're saying.
addition to, yeah, in addition to actually making people healthier and and understanding what health is.
Yeah, imagine that, making the health
Yeah.
of the people primary. We do have a comment here from Daniel Luna. Daniel's a friend of mine, works in the DPC space, consulting on finance. What are the challenges that pre-launch or new DPCs need to face versus established DPCs? I don't know. What are your thoughts on that question here?
Yeah, so I think Daniel, if you're asking about this related to employers, I think the challenges are just, speaking their language. DPCs are usually, they're in many communities around the country, and they're trying to create relationships with employers and educate them about, their practices and why they should consider providing that type of care to their employees. But the doctors don't know a whole lot about insurance, believe it or not. And so they talk about all the great things that they can do in DPC, but employers are usually more concerned about, what about the hospitalization and the cancer and the surgery and all the bad things that that we're worried about. And so that's usually what I find as one of the biggest challenges of kind of speaking employer language, is not really having a good answer for those types of questions, which I myself didn't have those good answers either, which is why I decided to dive into the world of insurance 10 years ago, because I got asked those questions so many times. I was like, I have to learn more about this and figure out how to have better solutions for
Mm.
businesses that are interested in our model.
Yeah, and so to kind of address that, you talked about more serious conditions. Is it possible to create a plan that combines DPC with specialty care, catastrophic hospital coverage, cancer treatment, and all that?
That's exactly what we do at Virtuous Benefits. So yeah, we create ACA compliant health insurance plans. They are no different than your Blue Cross or United Healthcare, except there is no Blue Cross or United Healthcare involved. Um,
Mm,
and that allows us to pay wholesale prices through insurance for things, for everything that people need, hospitalization, surgeries, cancer treatment, every bad thing you can think of, expensive medications. And it allows us to give everybody that are members of our health insurance plans miles better primary care.
mm. I'm kind of thinking about Daniel's comment here too about, let's say that a doc, kind of going back to the business of DPC here a little bit. If a provider is going to think about starting up a traditional payer model business, how would startup of a DPC model business kind of differ, in terms of, like, I'm about to start this business, what might I be thinking about differently if I'm starting a DPC practice?
Sure. That's a great question. So the first thing that comes to mind is overhead.
Mm,
When you open a traditional insurance-based practice, you've got to have infrastructure in place to be able to bill those insurances strategically, to be able to basically play sort of this game against them. Insurance and doctors are kind of like a bad marriage. Uh,
you're
they
stuck
both,
together.
yeah, they hate each other, but they need each other. And so, so insurance companies play games on how do we pay the doctor less, and then the doctor's office plays games on how do we bill as much as we can, and then and they kind of meet in the middle. And so you have to have people that do all that, staff in your practice to so you've got to have a bunch of billing people, you've got to have a bunch of support people like medical assistants and nurses and things like that to sort of keep the volume flowing, right? Because as a doctor, you kind of need to keep moving every 5-10 minutes. And the reason you have to do that is because you're not getting paid enough by the insurances to keep your lights on if you're not seeing that 25 to 40 patients a day. So in the DPC world, the doctors are so relieved when they decide to kind of take this leap of faith, because they're like, I don't have to do any of that. I can just literally, I just need a room that can fit an exam table and myself and a patient. That's really all I need, and a few supplies. So I mean, you can really get started very quickly, bare bones. There are some great medical record systems out there that have all the billing and coding stripped out of them, and they're very affordable, and you can really get rocking and rolling quickly. I think we opened an office in San Marcos 2 years ago, and I think from the day that the doctor told us that she wanted to join our practice, we were open and running in 30 days.
Wow. That seems incredibly short compared to the credentialing and all that stuff that normally happens with insurance.
Mhm.
Um, well, that's, if I'm a physician coming out of training and I want to be a primary care doctor, that's pretty enticing, right? I think, wow, less overhead. I get to connect with my patients. I don't know why I wouldn't want to do that. And I guess maybe that's a question, is why would anyone not do that?
Sure, sure. Um, and that the reason that doctors are fearful of taking a leap of faith and doing something like this is because unless they're independently wealthy, when they go to medical school and residency and get all their education, they generally come out of school with, I would say, at least 300, if not, $500,000 in loans.
Mm,
And so they're very heavily in debt generally when they start practicing medicine, and so they have to take that into account, that I need to be able to pay back my student debt. They also wonder, how can I get patients? I'm not a business person. I
mm,
don't know how to do marketing. I don't know how to do social media. I'm probably more introverted than extroverted, so I don't really like speaking in front of other people. How am I going to get patients? Because when I go work somewhere and I contract with Blue Cross and United Healthcare, they're going to send me patients. So how do I get patients? And
Mm.
that's the other kind of difficulty of taking this leap of faith is, I'm not a business person, and so I don't know how I'm going to do this by myself.
Yeah. Well, yeah, that's just one of the challenges of being a business owner, right? And it's a mindset shift, I would think, to some extent. And I'm sure there are people out there who can help get those kinds of practices started, right? I mean, are there consultants, or are there places where someone could get advice on that kind of thing?
There are so many resources. I mean, I love talking to new DPC doctors. I talk to probably a DPC doctor every single day. Um, what I tell them is, please use me as a resource in any and every way that you can. We've started our practice from scratch and grown it over 11 years. I've seen everything. I'm happy to run anything by you or give you any advice and guidance. And there are so many other doctors and DPCs that are also willing to help anybody that they can. I also tell the doctors, 11 years ago, even doctors didn't know what this was. My wife was just sort
Mhm.
of happened to be one of the pioneers of this, and so we didn't have a lot of resources. We didn't have help. We had to figure this all out on our own, and so that's even more of a reason why we want to be able to help others,
Mm.
um, because we know what it's like to have to do all this on your own. But there are so many resources, and I also tell them, don't don't whip out your checkbook and pay for all this stuff. Like, there's so many people that just want to help you for free and see you succeed.
Mm.
And we're one of those people. And so there are people out there that will prey on doctors, just knowing that they're not very business savvy, and so they'll promise a lot, charge a big fee for something, and then not really deliver. And so I warn DPCs, as part of your sort of overhead, keeping things reasonable. Don't just expect to pump a bunch of money into something and then expect the phone to just be ringing off the hook and you to get filled up, overnight, because that's
Mm.
how it works.
Yeah. We had another comment from Daniel. What do you wish DPC owners knew? Or maybe, yeah, what do you wish more DPC owners knew?
I think I think for DPC owners, just how to be better on the business side. I think that's what is probably lacking from DPC owners, right? Is just understanding how to run a business.
Mm.
Um, and really, on the how to run a business side, it's really the marketing,
Yeah.
and the education, and then also, um, when you're talking about employer healthcare, how to speak their language.
Mm.
Because there's a very special way to to talk to employers about healthcare, and help them kind of understand the
Mhm.
things around that are genuine. And it's just how to talk to them about those things. It's not something that they've ever been taught. So I wish they knew more about it.
Yeah, I think that is maybe the biggest challenge, is communicating not just to employers about these different models and how they can be useful, but also communicating to employees like, hey, we've got a different thing here, and this is how it's going to work. What have you seen? Have you seen, when businesses have worked with DPC, or if they worked with virtuous benefits to implement a direct care type of insurance? What are the employee reactions usually, and how does that change over time? And how can you maximize optimize that process?
Sure. The way that we present our health plans to employees when their employer decides to sign up is, we kind of tell them, you now have a concierge insurance plan, and these are concierge style doctors all in your area that are actually here, and you're going to hear from them speak very shortly about why they left a traditional system and why they genuinely want to take care of you guys. and they can handle almost 90% of your care. So everything kind of starts with them. And then Virtuous Benefits, or us, are your concierge for everything else. So when you need to go outside their office for something, to the cardiologist, to get an MRI, to get blood work, you're just going to shoot us a text or call us, and we're going to help you with that, right? We're going to hold your hand. And you're not asking us for permission. We don't work for the insurance company. We work for you guys, and we want you to pay nothing or as little as possible when you go get care. And so, because your insurance card with us doesn't say Blue Cross or United Healthcare, something that a front desk person would recognize, if we don't help you, you're going to feel frustrated when you go there, because they're going to look at the card and say, we've never heard of this insurance. We don't take it. And we just don't want you to be frustrated.
Mm.
So that's kind of how we do our presentations, to help employees kind of understand what we're doing. How do they react to that? We have, you have kind of a mix, right? You have some people that are like, wow, I love this. This sounds great. Like, you're giving me free primary care, you're giving me free labs, free imaging, free medicine, free home sleep studies, right? Everything that we can make free for an employee, we will do. But you also have other folks that are like, have their guard up, because they employees are kind of funny in that respect, where they just think if a change is happening with my employer, it's something that they're doing to better themselves and
Mm.
work in our situation. And
Mm.
so they kind of automatically have this guard up that, like, I thank you for all that, but I'm keeping my own doctor that I've had for 10 years, and I'm not going to use your doctor.
Mm.
And so there's education we do around that as well, just to explain to those folks that's perfectly fine, right? We don't want to force anybody to use something different, especially if they have a good situation going on with their doctor. We don't want to take them away from that. But what we do want is for them to have a conversation with their doctor,
Mm.
especially if they've had them for 10 years. Make sure your doctor wants to keep you too. Make sure it's a two-way street, right? Because if your company's health plan is now giving you a doctor that's going to allot an hour every time you need to work with them, they're gonna give you their cell phone number so you can text them or call them on the weekend or at night. Ask your doctor if they can do those things, right?
Mm.
Can they give you wholesale prices on labs and imaging? Um, the vast majority of the time, the answer is we're not set up for that.
Mhm.
And so, now the employee has a choice to make, right? They've got a health plan that's offering all of this, and um, and we ask them just to give it a try. And if it's the worst experience you've ever had, please give us the feedback afterwards. We're not going to keep you in that situation if you hate it.
Mm. A lot of times, these decisions are driven by cost. And now my question is, if, let's say, an employer wants to incorporate a direct care model of benefits for their staff, can that employer expect to see their costs go down, stay the same, maybe go up a little bit? What is the outlook for, the health benefit spend of a healthcare clinic with some, let's say they have 10, 20 employees or whatever? What is their outlook when working with that sort of model?
Sure, that's a great question. Yeah, how do we help employers save money is really kind of what I heard there, right? And
Yeah.
so it's a couple of things. So when you have this open access plan that has no network restrictions, which means anybody can go anywhere they want, there's no HMO, there's no PPO. It's just every single medical clinician, practitioner, provider in the country is you can go there. It's considered in network.
Mm.
When you have that type of plan, you're able to kind of walk in everywhere, and we do this for them, but we call everywhere and we say, what's your cash price for this? What's your self-pay price for this? And you'll start to see, if any listeners want to try this yourself, call an imaging center and ask them, what's your cash price for an MRI? And they'll probably say $3, $4, or $500. We're all used to seeing, $2,000, $3,000 bills for MRI. So you can see the dramatic difference when you go ask somebody, what's your cash price? Things drop by 10 or 20 times the price. And so that's one way, right? We're just significantly
Mm.
reducing claims that hit an employer's insurance plan by just paying less for the exact same care. Providers love it because they get paid in full at the time of service. They don't have to bill any insurance. They don't have to kind of go back and forth with like a Blue Cross and wait to get paid for 3 or 6 months.
Mm.
So it's really a win-win for both sides. And then the DPC care, it's just so high quality, such good access. None of it's hitting the insurance plan as a claim, and it's keeping people away from expensive medicine, ER visits, hospitalizations. And so when you've got kind of all this working together, you now at the end of the year, when we come back to an employer and we say, we've got your renewal, we'd like to discuss it with you, it's always a very detailed claims report that shows every single thing that happened in the plan: doctor's visits, specialist visits, medicines, how much did we pay for it, how much did they bill, and then how much did we pay for it, right? So they can see what's happening with the money. And then we can talk to them about their reserves. Out of the premiums that they're paying us all year long, we're setting money aside in a reserve account, and that's the money we're using to pay for the smaller claims. And if those claims don't materialize and there's a surplus in that account, then we can give that money back to the employer. So, so over time, you're starting to see sort of a net renewal almost always be flat or a decrease.
Mm.
Compared to, like I said, 10, 20, 30% increases on the network plans.
Mm. And so it sounds like the model, the virtuous benefits model, this direct care model, is it a self-insured structure, basically?
Absolutely, yeah. It's level and self-funding, and so level funding is basically self-funding for small employers.
Mm.
So we can actually do this. We have plenty of clients that have, believe it or not, 2 people, and
Wow.
we even have clients that have 1 family, but they own a business.
Mm.
They're a business with no employees. We can do this for.
Mm.
So yeah, these are group plans. I mean, you can go all the way from 1 family all the way up to, the sky's the limit. But it operates the exact same way every single place in the country. Anybody
Mm.
can go anywhere they want. Our team's going to call around, get cash prices, and help people get things paid for.
Mm. And I imagine there's some kind of a stop loss so that, there's a cap there, protection. Yeah.
There's always insurance built in the background that's picking up the big things.
Mm.
So your premiums are funding the small things, and then the other portion of your premiums are funding a stop loss insurance premium, which that stop loss insurance carrier is funding all the big things that we're all worried about, like the hospitalizations, the premature babies, organ transplants, cancer treatments, right? All the things we're worried about.
Mm. Awesome. Well, we could probably go on and on here about this topic. I think there's really there's not enough people talking about different models of ways to take care of patients, take care of the citizens of our country here, and the providers who are so stressed, I think, by the current system. And not to mention the employees. I'm an HR person, and I've got to think that the employees in a direct care sort of model, you've talked about the providers having more buy-in in the practice and all that. I've got to think employees probably pick that vibe up, and we're like, hey, we're taking care of patients. We don't have to count the minutes. We're not making the doctor walk out when somebody's crying and that kind of thing. And I would think as an employee in that sort of practice, they probably have a better experience too.
Absolutely, yeah. Our staff in our practice have mentioned more than once that, I'm so happy that I found you in direct primary care. I have friends that work in other medical practices that bill insurances, and it's so chaotic and it's so much work and it's very stressful. And, we just love that we can have such great relationships with all the patients and help the doctors, with all the things. And it's relaxed, and it's a fun environment versus just this chaotic environment, 24 hour, 7 kind of thing.
Yeah, yeah, that makes total sense. Well, for anyone that would like to learn more about DPC or virtuous benefits, Neer, how can people get in touch with you?
Yeah, you folks are welcome to visit our website, directmed.care for the DPC practice, virtuousbenefits.care for the benefits company. There's live chat there, our email, our phone numbers there. So yeah, would love to hear from anybody, any questions that anybody has, just things you want to run by me. I'm happy to have those conversations.
And I'll drop those links into the show notes as well. But Neer, thanks so much for joining us. I think this is such an important conversation.
I appreciate the time, Mike. This was a lot of fun.
Well, with that, I want to thank everyone who's listening and who will listen to the recorded version of this show. I'm super passionate about the practice of healthcare and bringing on people like Neer to talk about where healthcare is going and how we can take better care of our patients, our providers, and our employees, and really our whole world here. And so I think we can create a win-win-win situation. And I want to help healthcare leaders be better leaders and managers of their businesses. And so we kind of got to talk about all that stuff here today. And I'm going to continue to bring great guests onto the show. So please follow, subscribe, like, share the show with anyone you think might be interested. That would mean a lot to me. And write a review also. If you have the time to write a review, that would mean a lot to me. But with that, thanks for listening, everybody. Now go out there and lead with confidence. And I'll just close the stream here.